How are Sertoli cell tumors different from other testicular cancers? Imagine a tiny factory inside your testicle that helps support the production of sperm. That factory is made up of different cells, and sometimes one of these cells can develop into a tumor. Sertoli cell tumors are a rare type of tumor that come from the cells responsible for supporting sperm development. They are quite different from the more common testicular cancers, which mostly come from germ cells that produce sperm. Most testicular cancers, about 95%, are germ cell tumors. These include types like seminomas and non-seminomas, which can produce markers like alpha-fetoprotein or human chorionic gonadotropin that help doctors identify them. Sertoli cell tumors, on the other hand, are part of a group called sex cord stromal tumors. They originate from Sertoli cells, which are supportive cells in the testicle. Because of their different origin, Sertoli cell tumors usually do not produce the tumor markers that germ cell tumors do. Sertoli cell tumors are very rare, making up only about 0.1% of all testicular tumors. They often appear as small, localized lumps that do not cause systemic symptoms. And like germ cell tumors, they usually do not lead to elevated blood levels of tumor markers. This means that blood tests for markers like alpha-fetoprotein or beta-human chorionic gonadotropin are typically normal in Sertoli cell tumors. There are different subtypes of Sertoli cell tumors, including large cell calcifying and sclerosing types. Some of these, especially the large cell calcifying subtype, are linked to certain syndromes like Peutz-Jeghers syndrome or tuberous sclerosis. These tumors can sometimes cause hormonal effects, such as early puberty, which are not seen in germ cell tumors. When it comes to how aggressive these tumors are, Sertoli cell tumors tend to be less malignant. They have a lower chance of spreading to lymph nodes or other parts of the body, with less than 15% of cases showing metastasis. Because of this, treatment often involves just removing the tumor or the affected testicle, and chemotherapy or radiation are rarely needed. In contrast, many germ cell tumors can be more aggressive and requiring a combination of surgery, chemotherapy, and sometimes radiation therapy. In terms of diagnosis, Sertoli cell tumors usually present as small, localized lumps without the systemic symptoms or elevated tumor markers typical of germ cell cancers. Blood tests for tumor markers are generally normal, which helps distinguish them from germ cell tumors. This difference in presentation is important for doctors to determine the best treatment approach. In summary, Sertoli cell tumors are a rare, less aggressive form of testicular cancer that arise from supportive cells rather than sperm-producing cells. They are characterized by their unique origin, histological features, and clinical behavior. While germ cell tumors are more common and tend to be more aggressive, Sertoli cell tumors are distinct in their biology and treatment, making it essential for healthcare providers to accurately identify them. If you have concerns about testicular lumps or symptoms, always consult a healthcare professional for proper diagnosis and personalized advice.